Well, Dr. Downey, Dr. Chernoff, thank you so much for being with us this evening. We'll go ahead and proceed and starting with the webinar. We want to thank you all so much for taking the time and to be with us this evening. My name is Chad Ponciano. I am the co-founder along with Elijah Wheeler of MD360. I know that each one of you is experiencing the hardship and impact of COVID-19, and we want you to know that our thoughts and hearts are with you. For each one of you who serves on the front line, we at MD360 thank you, and it's your hard work and dedication that promises our family's safety and a better tomorrow. The presentation you're about to experience is not only about Intracel and Lipocel, but it's a presentation hosted on behalf of MD360, the 360E series, and in partnership with key opinion leaders Dr. Greg Chernoff and Janine Downey. Consider this our soft launch into the US market. MD360 was founded as an incubator for first-to-market technologies and is driven by consumer-centric branding. However, it's just not the technology we're passionate about. We're equally driven to create a community where continued education and improved clinical outcomes is as important as the acquisition. And this is where 360E comes in. As the year continues, you will see and start to see additional 360E events taking place, and we'd like to see you in attendance. When you see the 360E brand, it's our hope that words like education, coaching, development, physician mentoring, and career transformation would come to mind. The medical device industry wouldn't be here if it wasn't for our physicians. And it's time that we as a community create a community where physicians feel loved, supported, informed, and educated. With that, Dr. Chernoff, I'd like to go ahead and turn over the microphone.
Well, thank you very much. It's a pleasure to be with everyone this evening, especially as our practices come back up to volume. When we're looking at what we're offering our patients, and especially with what all of us have gone through, it's so important to listen to our patients as it relates to what they're seeking during this time. Many patients have heard so much about ventilators, are very frightened about ventilators. And so I, in fact, have seen many surgical patients come in for secondary consultations, asking what we have non-surgically now that we can offer them. As it relates to the Intracel, this has been a tremendous workhorse in my practice. When I look through my warehouse of, I've been at this for almost 30 years now, and when I look at my warehouse of different equipment that I bought that has become obsolete many times before I finished paying off leases, return on investment is extremely important to us when we're looking at any business plan. And currently the Intracel within both my Indianapolis practice and my Santa Rosa practice runs 8 hours a day. It is really an extremely efficient instrument, which really provides what I feel is one of the highest intersecting points of safety and efficacy. So I really want to go over with you what I refer to as the multiple applications of needle radiofrequency. I'm going to ask everyone if they will. I'm getting a lot of feedback, so if you'll put your systems on mute while the two of us go through our talks, I think we'll get through this a little bit quicker. So when we look at who's coming, and most of the talks that I've given over the last several years at most of our academy meetings really speak in relation to generational aesthetics. All of us who do surgical and non-surgical procedures see patients coming in their teens, coming in for unwanted acne scarring. We then move into the millennials who have a very keen desire to prevent as opposed to correct issues. So their skin desires and needs are very different then from the Generation X and the baby boomers who are still very much the baby oil and the sun patients. And with healthcare being what it is in the last decade, I'm seeing many more 70, 80, 90-year-old patients coming in saying, you know, I don't feel 70, 80, or 90, but the person that I'm seeing in the mirror doesn't match how good I feel in my heart. If you have something safe to help me, I'm really interested in this. So for those of you that have aesthetic practices, I really liken this to a restaurant. If you don't have on your menu things that will appeal to anyone walking in your door, you're really missing the boat, and you're really not doing your patients the service that they deserve by coming to you, if you want to maintain that patient and if you want to offer them one-stop shopping, as it were. Given the different areas of generational aesthetics, our patients still go through the normal signs of aging, beginning with the bony resorption, particularly with the pillars, the support pillars of the maxilla and the mandible, which then makes the gravitational descent of their musculature over the decreasing structural pillars look worse, coupled then with volume loss, particularly in the perioral area, in the midface, and really from head to toe, the loss of tone elasticity and of general skin quality. So we're really taking a turn from preventable aesthetics to the area of correctable aesthetics, and more people are coming in wanting to prevent issues. More people are wanting to maintain. We see the different sociological differences and cultural beauty narratives with the different skin types that we are seeing. Body dysmorphism, it still plays a very big part in what we do every day. So it's so important to observe your patient, to listen to them, to learn what it is that they're wanting to achieve. And the success that we've seen with really any of our in-office systems has been to really grossly undersell what they can do for them. And I think your patients will be really much happier. I often say to docs when I'm giving this talk that there are really very few in-office treatments for which a patient will come in and have one of and go, wow. And so many of the treatments that I'm talking to you tonight are not a one and done. Many of them involve coming in for a series of treatments. We offer pricing to encourage patients to do this, and I'm going to share with you then some of the things that we do to objectify the results that we obtain for our patients as well. So the majority of the non-surgical issues that patients come in to see me for really surround skin quality, particularly their loss of quality, tone, elasticity, general clarity of the skin as well. Whether you're a teenager, whether you're perimenopausal, any form of acne can be very deleterious to self-esteem, as can acne scars. I do as many female hair transplants as I do male. The pattern is just different. So alopecia, again, and things that we do implementing needle radiofrequency in this subset of patients is really a tremendous addition to our practice as well. Unwanted pigment, particularly melasma and post-inflammatory hyperpigmentation involving Asian, Mediterranean, Hispanic, African American patients really is central to why many of these patients come in seeking alternative forms of therapy, and most of their PIH has centered around treatments that have been performed on them that have interrupted the epidermis, caused inflammation, and this is why we're an area again where Intracel, because of the very minimal interruption of the epidermis, is far superior to this. Of many of the medical areas, patients coming in for certainly rosacea, psoriasis, and eczema would be atop these. Moving on then to scar therapy. Again, my average case, if I'm doing brows, eyes, face, neck lift, plus or minus something body, averages about 6 hours. You spend all that time operating, but what does the patient look at? What do they talk about? What do they share with their friends? Is what their scars look like. So anything that we can do to improve scar quality, to lessen healing time, to improve healing time, whether we're looking at an aesthetic patient or a cancer patient, whether we're looking at the face versus the body, is very important. Over the past 30 years, and I would really encourage anyone that utilizes this equipment to find something dear to your heart and give back to the community. So we have a foundation, a 501c3 for survivors of violence. Through this, we've accumulated sadly thousands of scar patients and learned a tremendous amount of scar therapy, for which the Intracel plays a very vital role in the area that we refer to as multimodality scar therapy, as evidenced by the next two patients I'll show you where we utilized the Intracel. On your left was a patient of mine who was 1 month before her wedding, and she never learned that it wasn't a good idea to put her drunken face in the face of her neighbor's pit bull while the pit bull was eating lunch, and so her lip became part of the pit bull's lunch. So we rotate some flaps to close this. In the post-operative phase, we utilize the Intracel to act as absorption channels for regenerative therapies such as exosomes. And by the time of her wedding 1 month later, again, you have to look really hard to see her injury. And most of these patients in the past were extremely edematous for a long period of time. The same with this Iraqi war vet who sustained this scar from temple to chin, where we utilize the Intracel as part of our multimodality scar therapy regimen, and we're really seeing results from a scar therapy standpoint that we weren't able to achieve in the past. So the indications for the Intracel are really, as we have mentioned, going from head to toe. As I mentioned, radio frequency is colorblind, so this is tremendous for any patient of skin types 1 through 6. And as I had mentioned, we treat really face, neck, décolleté would be the most common triad that we would do, but arms, hands, chests, backs, legs are also very commonly treated with this. Expanded indications, certainly in the areas of post-surgical fibrosis, and utilizing the needle radiofrequency to create absorption channels for regenerative therapies such as platelet-rich plasma, platelet-rich fibrin matrix, the exciting field of exosomes and stromal vascular fraction. Again, this is how we've been achieving results that we didn't really see possible over 10, 20 years ago. My father was a mechanic. He always encouraged us to look under the hood if we were buying any vehicle. And I always encourage docs, if you're looking at buying anything, to look under the hood and look at the specification sheet of these systems. And this is really what sold me very early on the Intracel. And as I mentioned, we've had ours since inception, going on 4+ years now. The three main sales features unique to the Intracel would be, number one, and we'll talk about these more in detail, number one, that it has a monopolar mode, as well as a bipolar modality as well. With the monopolar, you can have a much deeper penetration of the radio frequency and a wider swath of energy, if you will, rather than the more focused energy projection of the bipolar mode. Utilizing an internal impedance monitoring system as opposed to simply a surface temperature system has tremendous importance. As I mentioned, the Intracel has, I feel, one of the highest intersecting points of safety and efficacy, and the internal impedance monitoring really goes a long way towards this. Patients, if you hurt them, they don't like the treatment, and the very fast penetration of the needles of the Intracel really make this essentially a painless needle penetration feature for this. So as you put your foot on the foot pedal, the needles deploy. A fraction of a second later, the radio frequency energy fires. You can gauge the depth of needle penetration anywhere from 0.5 millimeters to 2 millimeters, and based upon the level of energy you're utilizing, also the level of penetration then of the radio frequency energy. So you get very specific funnels of energy deployed for the patient. We've combined this with another form of JASIS technology, which is the surface radio frequency. When you combine surface radio frequency with needle radio frequency, you really get what we refer to as one of the first systems that can give you triple layer therapy, where you have the ability in one session of treating the epidermis, of treating the papillary dermis, of treating the reticular dermis. And again, the benefit of having the monopole, that gives you a much wider swath of energy and a deeper swath of energy, because with the bipolar capabilities, you're really delivering energy only between the two electrodes that form the bipolar connection. So a tremendous benefit of the monopolar capability with this system. As I mentioned, Intracel is colorblind because as compared on the left with fractional CO2 energy, we're not interrupting the epidermis. The injury to the epidermis is very minimal, whereas we're still seeing the collagen denaturation in the papillary or the reticular dermis with this. The second main sales feature of the Intracel, as I mentioned, is the real-time impedance feedback system, whereby the system is measuring the impedance, is controlling then the release of energy. We know that as you increase temperature to the tissue, impedance decreases. In fact, in the area of about 2% for every 1 degree in rise in temperature. And as the impedance then decreases, we're having a deeper penetration of the energy. So this is how we're getting the radio frequency energy down to the level of where the fibroblasts live for ongoing fibroblastic stimulation and collagen, increased collagen production. By multi-pulsing, as we do with this, then again, the epidermis is being protected in between pulses. And so again, you're able to deliver the heat to the dermis while protecting the epidermis. What we then see histologically is what we want to see, and we see then an early immediate collagen contraction by the breakage of the hydrogen bonds, and you then you can see some immediate tissue tightening with the collagen bundles folding with this. And then over time, with the stimulation of the fibroblasts, you see collagen remodeling and the tightening of the tissue, as witnessed in both H&E stains and trichrome stains, where you see a much denser collagen bundling on the right after therapy. And here again with the trichrome stain to the right, again, you see a much denser formation of neocollagen and the denser bundling of the existing collagen and elastic fibers as well. We then can utilize this, as I mentioned, from head to toe. This had tremendous application. Many of you are still doing vaginal rejuvenation. We worked with Sherry Thomas, a urogynecologist in Los Angeles, and what we found was, again, the combination of utilizing the fractionated CO2 with the radio frequency gave much better production of surface lining of the vagina, as well as the improvement in urinary incontinence and fecal incontinence. Running through then patient examples, again, from a aging skin standpoint, here's an example. And as I mentioned, we sell these in packages. Most patients will come in once a month for this, on average for anywhere from 6 treatments. Many patients then will continue on the maintenance of this. So here's a patient after 1 year of therapy. And when you go from forehead to chin, again, you can see a general improvement in the tone, the quality, the clarity of the skin. Here's a patient only after 2 treatments, and she came in saying, you know, I know you told me that I would need more. I'm really happy with just the softening that I'm seeing and the improvement that I'm seeing. Another patient after a year of treatment, where again, you're seeing general improvement in the tone, the quality, the clarity of the tissue. With this patient, again, from forehead to chin, here she is after her 6 treatments spaced 1 month apart, utilizing monopolar level 7. And we were treating her on her face, neck, décolleté. And if you look again from forehead to chin, you see a general improvement in the tone, the quality of the skin, the fine static retids, particularly around the eyes, improvement around the mouth. And again, especially on the neck, you can see nice improvement in the tone, the quality, the clarity of the skin. Another patient who came in complaining of a lot of acne scarring, particularly around periods. She comes in once a month. We have them come in a week prior to their cycle beginning, and over the course of 1 year, again, we really see a tremendous improvement in the general tone, quality, and the clarity of her tissue. In an effort to objectify this, we utilize the Quantificare system. This is a tremendous system which quantifies wrinkles, pore size, the general evenness of skin, oiliness of skin, and it gives a measurement of hyperpigmentation as well as vasculature for patients. The bar graph, you see a +10. Quantificare has a patient base of 20,000 patients. +10 is the top 5% of the best patients. -10 is the worst 5% of the worst patients. So after treatment, you see that, again, all of their scores improve in the level of ritids, pores, oiliness, evenness, the unwanted reds and the browns in tissues. This is a great way to quantify for patients. In my hair patient base, again, we utilize this in conjunction with PRP, PRFM, utilizing the Intracel along the anterior hairline and into the hairline, then applying PRP, PRFM. I also utilize this for my hair transplantation patients to pre-treat the recipient areas. You can see 6 months after utilizing the needle RF and combining with exosomes as well, we see thicker hair growing on the side as compared to the control side. And as was mentioned, the scar management population, we see amazing results with Intracel. So here's a patient both with active acne. We know that this helps decrease sebaceous activity. It helps to improve collagenesis so that we're seeing improvement in scars. Again, in active acne, going down to 2 millimeters, and especially in cystic acne at level 7, after 6 treatments, again, we're seeing nice improvement and stability for this patient. At 1 year after coming in once a month, again, this patient, tremendous improvement in her acne scars and in her scarring. As seen with this patient. As you can see with this patient, the Intracel does not treat the affect of a patient. She still looks miserable, but her skin sure looks a lot better. This patient's scarring, again, tremendously improved with the Intracel, a treatment once a month spaced for 6 months, spaced 1 month apart. On purpose, I've picked skin types really of through 1 through 6. So in this Middle Eastern gentleman, again, very common to see malar scarring. You see nice improvement, as with this patient in the mid-face, nice improvement of her scars. Again, this was after 6 treatments spaced month apart. This Asian gentleman, again, nice improvement in active acne and acne scarring. In this type 5 to 6 patient, again, no hyperpigmentation after these treatments, but a consistent, nice improvement. And this is really a treatment where patients see ongoing improvement with each treatment. As with this Indian patient, beautiful improvement in her both saucerized and pitted acne scars. This Caucasian patient, his pitted and acne scars dramatically improved after 6 treatments, as with this patient as well. In some of our survivors of violence, this was a patient who was raped at knife point. We find that any improvement in the physical scars often heal the psychological wounds, which are often much deeper. So again, after 6 treatments, her scars are really much improved, as with this patient. She's, after 3 treatments, we're starting to see improvement. As with this patient, again, we're starting to see improvement in the topography. This was an overzealous pulse dye laser treatment to perinasal telangiectasia, which is inherently one of the greatest areas of scarring. This was only after 3 treatments spaced a month apart, barely visible at this point. This patient with the pitted scar right upper lip, after 3 treatments, dramatically improved. This cleft lip patient, again, nice improvement in his scar. This malpositioned cancer resection, again, after 6 treatments, nice improvement. After 12 treatments, again, we're really on the road to making this barely visible at conversational distance. Another cleft patient, very happy after 1 year of treatment spaced 1 month apart. Non-facial areas, it's the same thing. You'll see over time ongoing improvement in both topography and activity of the scarring. Unwanted acne scars on the back, on the chest, you see very dramatic improvement. This is a patient who was a cutter So these patients, again, deep psychological wounds, the sooner you can soften these, the better. We get her after 4 treatments to the point where makeup can now cover these. Post-surgical scars, both breast augmentation, reduction, as well as abdominoplasty scars. We started working on the patient's left-hand side, and so you can see that we're starting to see nice softening of that scar. Just for those patients who have a decrease in laxity in their midriff, we see beautiful improvement. This is after 6 treatments spaced 1 month apart with this patient, as with this patient with the piercing with the stria. Stria, we see beautiful results, particularly if they're still hypervascular. So the faster you can get at these, the quicker your opportunity to make these barely visible to conversational distance. I'm not sure why this bothers many women. It does, unwanted ritids around the knees, but again, here's a patient, a treatment a month, spaced 6 months apart. So it's been an interesting voyage looking at needle radiofrequency without hesitation or reservation. It's one of our greatest return on investment treatments that we do. We run these as packages. Typically, if we're going cosmetically, face, neck, décolleté, we're charging $1,000 per area. Scar patients, we have a greater desire to help them than to not, so it's really based upon their financial ability to pay. On average, we're getting anywhere from $250 to $500 a treatment when we're dealing with scars. So I'm happy always to help anyone as they embark upon this, but again, this has really been one of the best systems that we have acquired in my 30 years because it is so versatile, because it's so safe. And again, at the end, I'd welcome any questions from anyone. And again, I thank you for the ability of sharing this with you.
Greg, if you can hear me,
Yes.
Can you hear me? Hmm? I thought the presentation was awesome. So while they're transitioning over to my presentation, one of the things that I like the best about the Intracel, being a woman with skin of color, is the fact that it can treat all skin types, like you emphasized. And so from my perspective, the return on investment, I think, has been fantastic. I don't have those lines around my knees, but women hate those lines around the knees. And so I'll do a combination of Kybella and Intracel there, or Kybella and Intragen there, that type of thing. But we hate that. In terms of the other photographs that you showed with the skin laxity, I'll do a combination of Excelis and Intragen, excuse me, and Intracel on the stomach for that skin laxity area as well. So we have many tools in our kind of like toolkit, but I loved some of your pictures and I thought it was an absolutely awesome presentation. I couldn't agree with you more about what you said earlier. You're comparing, I think you said a pickup truck. I would say an old, outdated pickup truck to a Ferrari when you're looking at the handheld versus the Intracel technology. And for me in particular, so many of my patients come in that either used to smoke or drink a lot of coffee cups through, or drink a lot of coffee through their coffee cups and wind up with those fine lines or deep lines all over. So I'll hammer them down with the Intracel, and then I will use either Restylane or Bobella or Juvederm to treat some of the deeper kind of wrinkles and rhytids in that area, which works out very, very well for me. So I couldn't agree with you more about the versatility.
Again, I look forward to listening to you.
Absolutely. So now, can you guys see me okay? Elijah?
1 second here.
Okay. So while they're figuring out the tech piece of this for a second, the other thing I wanted to say about your presentation was I find that at different times of the year, people will come in for different things. I was seeing a lot more patients in February and early March before we had to close down because of coronavirus, that were coming in because they were thinking in advance about their acne scarring on their back. They're thinking about surgical scars, you know, that type of thing. So, you know, I think that sometimes the results will be, you know, like kind of subtle, but I don't find that they're subtle, you know, not at all.
No, again, patients, it's our patients that make us like these systems, and our patients really, without exception, have loved what the Intracel can do for them.
Okay. Yep, exactly. Okay, so good. So they can now see me. That's good. So anything else you wanted to discuss from your presentation before I get started with mine? No? Okay. All right, so let's start with the first slide. Elijah's going to help me run through this. So I'm going to be talking about, so I'm Dr. Janine Downey. I'm a board certified dermatologist. I practice in Montclair, New Jersey. I've been in my own practice for the past 20 years, been practicing for 23 years. And I'm going to be talking about the Lipocel technology. Next slide. Okay, so when I'm thinking about, you know, my different, you know, kind of my road to fat melting devices, I myself, I exercise 7 days a week, so I over-exercise. I was admitting before that I have a huge sweet tooth, especially for chocolate, so I'm not perfect. So I like to shop for myself. So when I started looking at fat melting devices in 2010, 2011, I was shopping for me and my patients. So my first fat melting device that I ever got was the Excelis, which is a radio frequency device that BTL makes that I still use in my practice now. That's been very much of a workhorse. And that was in January 2011 that I got that technology. And my patients have grown in enthusiasm and in interest for non-invasive fat melting procedures. A lot of people have had liposuction once, don't ever want to have it again. A lot of people don't want to have liposuction, and when they want no surgery, no lipo, and they want to discuss, you know, kind of non-invasive technology and what's happening. These days, the reason that I decided that the Lipocel would be good for my practice, I looked at the old Liposonics. I used the old high frequency ultrasound that was available. It's very painful, and the Lipocel is not painful at all. So if patients have to be put under the influence of Valium and they can't drive home, that's a significant reason that right there why they may not want to do a non-invasive fat melting procedure, as was very common with the Liposonics, that people couldn't tolerate the pain. And I'm a soldier and I'm very vain, and I'm happy to say that in front of the 250 some odd people that are watching, and I'll say it to anybody. I name my practice Image Dermatology because I am vain, so I'm okay with that. So I've soldiered through, I think, 2 Liposonics treatments, and they are painful. And so with the Lipocel, I love the fact that it was a high frequency ultrasound that was not painful at all, that was faster, 30 minutes, non-invasive, no downtime, and something that you could use on all skin types. So that's kind of the algorithm that led me to looking at the Lipocel, getting interested in the Lipocel, believing in the technology, and moving to the Lipocel. So that would kind of be why, in terms of the market demand. For me, I market in my office I have a Touch MD system in my office. So that means I have a computer screen in every room so people can read about it, scroll through it. I market on my website, and I will market some on my Instagram, depending on, you know, what exactly it is. So I do believe that, you know, obviously these days, there's a huge demand for non-invasive fat reduction. 69% of American adults above the age of 20 are now considered either overweight or obese. So, you know, that's obviously very unfortunate. And some of you guys heard us discussing the female statistics earlier of being overweight and obese. So roughly, according to the American Medical Association, is where I get these statistics from. So I'll just say roughly 78% of African American women are either overweight or obese. Roughly about 70 to 72% Latino women are overweight or obese. 66 to 67% Caucasian women are overweight or obese, and 57% of Asian American women, 57, 58% are overweight or obese. So people are, unfortunately gaining weight, especially with the coronavirus quarantines that have been put in place in, basically throughout the nation. People are going to be social distancing, but not distancing from their refrigerators and gaining weight. So the optimal BMI I'll discuss later, but somewhere between 25 and 30 for the Lipocel, which I will also discuss later, I combine with different technologies sometimes, and other times I'll use kind of by itself. So when patients are seeking kind of a safer, more comfortable result without side effects, they don't want no downtime. They don't want to put on liposuction garments. They don't want to worry about, things draining after a liposuction procedure. So with the Lipocel, basically what they're doing is fixed at about $2,500, and you can expect a minimum profit of upwards of $40,000 per 20 procedures, because people will pay because the results are there and the results are real. Elijah, can I have the next slide? Okay, so looking at body contouring, there's the thermal effect and there is the mechanical effect. So with the thermal effect, you get the ultrasound heating, which leads to true apoptosis, which is the fat cavitation. So that is the dissolution of the fat. You can do that with laser cryolipolysis. You can do it with some radiofrequency devices, and obviously mechanically, you can do it with vacuum, with liposuction. You can do with endermology, and shock waves I'm not as crazy about at all. So those are the different procedures that you can do to involve yourself with non-invasive fat melting technologies and mechanically with invasive technologies. Next slide. So in terms of focused ultrasound, the ultrasonic ablation therapy is similar to the effect of a magnifying glass, which is an interesting kind of algorithm, because what that does is it actually focuses the targeted tissue to reach a higher temperature of 65 to 100 degrees Celsius at the focal point. And so the applications would be skin tightening, fat ablation, some cancer treatments through the ultrasound transducer. So it's very, very interesting. And like I said, I mean, I've done this procedure on myself. I've done it on my patients. It works very well in patients. I take the, I'm mean, so I weigh patients when they come in and I measure them, because this is New Jersey and people tend to overeat. Unfortunately, you guys see our ex-governor, Governor Christie, we can tend to overeat. And I mean, I'm just going to say that because sometimes people come in and they've eaten too much and they've gained weight because they think this is a get out of jail free card, and it's not. So I hold them to it by measuring them and weighing them every time. And I think that's a good way of keeping your patients honest, so they're not sneaking and eating and then saying your machines have failed them. I'm all for personal accountability. Next slide, please. Okay, so in terms of procedures, this uses non-invasive method that doesn't damage the peripheral tissues at all. So it transmits energy precisely to the subcutaneous fat layer. It eliminates the targeted fat cells permanently and induces a metamorphosis of the collagen fibers, which achieves kind of like a lifting but yet flattening effect. And then the elimination of the fat cells, like I said in the last slide, it causes apoptosis, which is when you truly eliminate the fat cells. And so the healed fat cells, helped by macrophages, are discharged from the body through the lymphatic system. With some fat melting technologies like the Vanquish and the Excelis by BTL, you do have to drink a ton of water. I don't think it hurts to drink water. I ask the patients to exercise as much as they usually do, or to perhaps exercise a little bit more, because I feel strongly that that's not going to hurt them at all. And then it just actually gets exited through the lymphatics. And so the results are a volume reduction that's noticeable post-op. Then there might be a little bit of swelling, and then that reduction improves for up to 4 weeks. And after 3 months or 12 weeks, you'll see the maximum effects. So combining methods such as massage will stimulate the lymphatic circulation and quicken the effect. And that is why I'll have them exercise as well. And like I said, I just try to have them focus on their diet and not go off the deep end and think this is a get out of jail free card, because unfortunately some people in New Jersey, that's how they roll. So I have to make sure that I monitor and keep them under control. Next slide, please. So you have high power, contact cooling, stable energy, and it's very easy to use. So this is technology that I will have my medical assistants do here in the office, and they'll come, they'll assess patients, they'll tell me, I think this is a great candidate for this, I don't think this is a great candidate for this. but it's very, very, very easy to use. And so that way the doctor can come in the room, say, okay, I want to do the Lipocel. You know, you're going to need Kybella for the area under your chin. Let's look at what else you're interested in doing and kind of go from there. So that's very much of a good thing. Next slide, please. So that's the Lipocel system, the handpiece and the cartridges that we use. And those cartridges feel very cool on your skin, which is a good thing. And you know, I've had 1 or 2 patients who have felt like, oh, you know, I can feel this, you know, but not in a bad way at all. So I would say that this is something that you can feel, but not something that's painful. It's not something that's intense, and it's not something where you have to kind of hold your breath and grin and bear it. I feel that it is a pretty painless procedure, and I myself am a full-on baby. Although I like to say that I am vain, I am a full-on baby when it comes to different things, but I will soldier through anything. But this is something that I did not have to soldier through because it is, you know, pretty much I can feel it, but it's not significant and it's pretty painless. So that's a real compliment coming from someone like me. Next slide, please. So if you look at the treatment lines, you do 2 millimeter line spacing. And at this point, my medical assistants are better at this than I am in terms of figuring out where they're going to place the handpiece to move along in a linear fashion and make sure they don't miss any areas, because you have to obviously have an even circumferential distribution of the fat cells melting together to get good results. All of us have seen results from liposuction cases. I trained at liposuction when I trained at Mount Sinai 1,000 years ago. And all of us have seen liposuction cases where one area of the stomach was a little bit fuller, the other area of the stomach was less full. So you want to make sure you're staying in the lines when you're doing the procedure and spacing it out properly, so you're getting proper dissolution of the fat cells. Next slide, please. Okay. So the contact cooling, like I said, is really very, very helpful, and it decreases the pain in the epidermal and the nerve areas. And the contact cooling allows for the safe and comfortable use of the higher energy ultrasonic, frequencies. So with the liposonics, for example, they had some semblance of a contact cooling, but it really wasn't cool at all, and it was hold your breath painful. With this technology, it is not at all. And the other issue with the contact cooling is that it's very helpful in terms of treating skin of color patients so that they don't have any hyperpigmentation after they've used the Lipocel. So this is the other reason why this is good, because I want technologies in my practice. I see about 60% or so Caucasian patients and about 40% African American, Latino American, and Asian American patients in that order. But I see a bit of everybody. And because I see a bit of everybody, I want to be able to use devices that are colorblind that I can use to treat everybody. So that's very, very important to me. Next slide, please. So the contact cooling, like I said, you can feel it, you can feel something, but it's not painful. It does protect the epidermis even at the higher energies. And so therefore, because it's not something that's painful and it's not something that's too intense, it has a very high degree of patient satisfaction. And some patients that come in, it depends obviously on the amount of fat that the patient wants to decrease specifically. But a lot of patients will come in and they'll ask me, well, is this a one and done? And it just depends. If their BMI is somewhere between 25 and 30, that's what I typically treat. I will tell them sometimes it's 1 treatment session and other times it's 2 to 3 treatment sessions. Like I said, in New Jersey, we have a lot of good restaurants. We're right next to New York City. We can really eat. And so, you know, we exercise, but we can also eat. And so sometimes people are 3, but it just depends on what their goals are, what their pocketbook, you know, wants to spend, and, you know, ultimately what they're, you know, what they want to do. I mean, if patients want to exercise throughout you know, the procedures, then they might have better results. If they want to watch what they eat, they're going to have better results. If they're drinking alcohol every night at dinner, they're going to not have as good results because of the sugar content in all alcohol, especially in beer. So these are the things that I share with them, and then I, you know, try to be very blunt and honest with them about. Since it has the contact cooling system, it actually reduces the handpiece surface temperature down about 5 degrees Celsius. So like I said, it's much more comfortable for the patient. If the patient is comfortable and they're not complaining, they're going to share it with other people that this was something that was, successful and relatively painless in terms of the procedure, so that you'll wind up getting more customers, which is another way now that our quarantine has been lifted that I'm starting to get more patients. Next slide, please.
Hey, Doctor, I'm sorry for interrupting you, but what you're saying right now is obviously really important, right? So you've had, was it 2010 you bought your first body contouring device?
Yeah, like it was January 2011. Yeah, I was shopping around in 2010 and kind of seeing like the endermology and the old versions of some of the lymphatic drainage units that I wound up not getting. And then they had the first iteration of the cool sculpting back then too, which gave me, giant hive-like somethings. I don't even want it, it looked not great on my abdomen for like 4 months and left me with a little bit of hyperpigmentation. But now those companies have all worked out their issues. So it's from January 2011 to where we are right now in, almost June, but May of 2020.
So outside of cool sculpting, you've had obviously a number of years with experience with bulk thermal heating to create apoptosis. So my
Right.
question to you is, when you're talking about this technology is contact cooling, right? So it's really extremely unique. The amount of energy you're delivering with that technology to actually not only just increase comfortability, but actually cause protection, correct?
Right, exactly.
Is it,
And so that's what's so critical. Sorry?
What's been your experience so far with that? Because it's dramatically different, it's completely different from the older technology in terms of really we're promoting I want to say a virtually pain-free body contouring application. Is that helped your practice in terms of marketing, advertising, and patient just satisfaction?
The fact that it is something that you can feel, but it's not something that's intense. Like I'll market the Lipocel with the M-Sculpt for some people, depending on their fat content in their abdomen in particular, because the M-Sculpt you can use on the buttocks. I'm not really using the Lipocel on the buttocks at all. I'm using the Lipocel mainly on the abdomen. If somebody has a very fleshy, like kind of like upper arm, and sometimes in the inner thighs is where, by the way, those are the 3 areas I'm using the Lipocel. I'm not just using Lipocel alone on the abdomen, but I'll market it together with another technology, or I'll market it by itself. But the fact that it's contact cooling, that the patients aren't feeling any discomfort, because take the technology, the older technology from the Excellis, it's still technology that I use now. But even with me, when they were doing the Excellis on my abdomen, it does heat up. And so the fact that this has contact cooling is fantastic. It's something like, if you think of like the Cutera, the XLV, the YAG laser, the XLV, that also has contact cooling. So that's why you can use it on so many different skin types. But for a non-invasive fat melting ultrasound machine to have the contact cooling has been a bit of a game changer for my practice in terms of the fact that patients aren't suffering. So if they're not suffering, they're happy and they're coming back sooner. So this is a good thing. In terms of a temperature comparison on the surface of the skin, if you're looking at without the contact cooling versus with the contact cooling, what you're seeing is you're actually seeing areas where, patients they get upset when, they're in some type of discomfort, and you don't want them in discomfort. But without the contact cooling, it's about 20 degrees Celsius or so. And with the contact cooling, it's about 5 degrees Celsius. So that's much more comfortable and far more tolerable in patients. And I just don't want the heat transfer for any of my patients. I mean, many of my patients come in and, if I'm hyperpigmenting them, that's not going to work. They're there to reduce their fat, not to get hyperpigmented. So next slide. So in terms of energy levels with and without cooling, that's pretty clear that you're going up to 85 joules and 30%, that's 33%, versus going down to column C, the with cooling at 5%, the with cooling here is 5%, and that's 40%. And the next slide is, the next line is 25%. So you can see the energy levels without the cooling and with the cooling. The with the cooling are going to be strongly preferred, and you can get to higher joule levels and therefore have more efficacy because you're at a higher energy range, even though you're using the cooling. So, it's just positive. It's a great thing. And it's going to make this technology, I feel like, be much more of a blockbuster. Next slide, please. So more effective, more comfortable, little or no downtime, and a faster treatment. And like I said, with the liposonics technology, you have to give people Valium, you have to give them something that's going to twilight them, and then they, have to have a driver, Uber driver, whatever, take them home, a family member. But with this technology, the Lipocel technology, the absence of anesthesia, the whole procedure, depending, 30 minutes, sometimes in my practice it's 30 to 45 minutes depending, but it's certainly less than an hour, and they're in and out of there and they're driving themselves, so they have autonomy, so they don't have to worry about other people, picking them up and, taking them back home again, that type of thing. And because the epidermis remains safe, because the direct focal zone is formed only on the subcutaneous fat layers, which is below, you have no downtime. I get a little bit of swelling with some of my patients, and I have, like point 3 says, seen some purpura sometimes, and the purpura typically resolves in 3 to 7 days. It's not lasted for more than a week to my knowledge, and my patients are very vocal about, any side effect or anything that's going on, so I would know that. And for myself, I haven't had any purpura at all. Next slide, please. So in terms of the clinical information, obviously, it's contraindicated if patients are pregnant or if they're lactating, patients with hernias, and patients that don't have any fat. So there will be some patients that will come in my practice with no fat and want non-invasive fat melting that have body dysmorphia. That's not going to work, and so I won't do that on them because it's not a valid technology for people that don't have any fat. Patients whose BMIs are over 30, like I stated before, I typically do it on patients whose BMIs are somewhere between 25 and 30. So if they're over 30, they might fail to obtain the effects that you would want them to have. So perhaps you want to do a different technology first, or encourage them to lose some weight first before they come back and see you later. There have been some cases. There was a large gentleman that was getting ready for his wedding, and we did a little bit of Vanquish on him to get him down some and melt some of his fat before we were able to do the Lipocel. And then unfortunately his wedding got canceled, so he has more time to exercise now. So hopefully we're going to see him back. I know he's scheduled to come in sometime towards the end of June to resume treatments. Like I said, it's not recommended for patients that have a huge BMI that aren't willing to watch their weight, because they're just not going to succeed, and you don't want that. And if patients have large scars in the area from like emergency surgeries, that type of thing, that might not be a great candidate, because they might not see the results or appreciate the results that they're getting. You do get edema, you can get some purpura, and many of my patients have experienced itching after the procedure, and I do want patients to exercise. So I tell my patients I exercise 7 days a week. I do want my patients to exercise religiously after this procedure, and to try to keep up and not slow down on what they're typically always doing to try to maintain their weight, or for that matter, to lose weight. Next slide, please. So looking at the cartridge depth, the power level, the working area, and the stacking times, the treatment level needs to be adjusted by each patient's, like, kind of their body weight, what they want, what their ultimate goals are, and the decisions of the treating physician. So the stacking times are 1 to 5 times per one treating point, but this has to be subject to change, because some patients will be more kind of, heavier in the center of their abdomen, heavier in the lower side of their abdomen, and then out towards their flanks. Perhaps they have less body fat there. So it really depends on, kind of like what you map out for your medical assistants to do, exactly how each individual patient is going to be treated. Because all fat depositions are different, although patients all come in saying that they have the worst stomach that I've ever seen in my life. And it's typically never the case. It's always somebody who, could use some non-invasive fat melting, but doesn't have a terrible stomach, quite frankly, at all. Next slide, please. So case studies. So looking at the clinical information, we're looking at their height, we're looking at their weight, we're looking at their percentage of body fat. Like I said, I think you should be weighing and measuring the patients every time they're coming in your office so you can keep them kind of like accountable for what they're eating. I do look at their BMI. I think that that's important to look at their BMI. I look at their measurements in centimeters of their above their navel, their waist, below their navel, all of that. I think that's very, very important. The fluence levels, the stacking times, and the total that we have you know what, I'm going to rush through this because this is clear. The pain degree isn't significant, but I do want to show some before and after pictures. So in terms of the first treatment after 1 month, the second treatment, and that's after 2 months, you can see a significant decrease in the waist. The next one, yep, okay. So first treatment, and yep, thank you, turn to the side. It's down significantly, and you can see it's an appreciable difference in terms of this patient information. Next slide, please. So patients are very happy when they can have weight loss, when they can have fat loss like this. They're absolutely thrilled. Next slide, please. And you can see from all the different angles how good she looks after having the second treatment and 2 months down the road. Next slide, please. So looking at men, the first treatment, after the second treatment, after the third treatment, and then 1 month later, that's a very significant difference in terms of the centimeters lost. He's lost over 3 centimeters, would totally be delighted. Can we see the side view? Again, you know, looks really, really great. Very, very nice, you know, loss of fat preponderance in his midsection. Next slide. And there you see some significant loss again. You know, this is somebody who's going to look better in their clothes, look better in their bathing suits, and feel more confident. Next slide. Good. And looking at this gentleman, lost a significant amount, lost over 3 centimeters as well. Going to feel better, going to look better, and quite frankly, without the preponderance of abdominal fat, you're ultimately going to live longer. Next slide. Yep, very good. Next slide. So this is somebody who's thrilled, who's going to recommend it to other people, and who might come back for a touch-up if they need it when they start slipping, which, you know, unfortunately many patients will do after some time, and some patients refuse to do again, depending on the mindset of the individual patient. Next slide. Okay. All right. Thank you so much for your attention, and thank you so much for your time. Do we have time to take a couple of questions? Do we have time for a couple of questions?
Sorry about that. Can you hear me?
Yes, now I can.
Great. How does Lipocel compare to Sculpture in terms of results? Have you seen hyperpigmentation with Sculpture?
So I have not used Sculpture in my practice. I have seen cases of Sculpture referred into me of mild to moderate hyperpigmentation, never severe hyperpigmentation. So those would come from other doctors that have Sculpture either in the city or in the area. And typically I'll do like a medium depth chemical peel and give them a fade cream, but I don't have personal experience with Sculpture besides at the trade shows. But I would say that the results of the Lipocel are better than the results of the Sculpture for sure. And then with the Lipocel, that can complement something like the M-Sculpt, because the Lipocel is going to take off that layer of fat that we just saw so dramatically in those photographs. So it's going to take off the layer of fat, and then the M-Sculpt can turn around and build more muscle, which is a good thing. And like I tell my patients, I mean, quite frankly, this is something that you feel like you're being vain, but it's also going to help you live longer, because if you don't have the abdominal preponderance of fat, you'll ultimately live longer. So that's not a bad thing. And perhaps along the way, they're developing better eating habits. So, you know, that's my hope.
This one's for Dr. Chernoff. I'm wondering if I can, please, 1 second here. I gotta get him off. Second.
I feel like you can share it because we were shared before at the beginning when Greg first came on.
There, I'm released from my muted state.
Released. No, okay, next question, Greg. This comes from the Midwest. How often do you perform Intracel procedures and cost per session?
Well, we perform Intracel procedures 8 hours a day, every Monday through Friday. And from an aesthetic standpoint, the most common combination that we do is face, neck, décolleté, and we charge $1,000 per area, so $3,000 for those sessions. If we're doing scar therapy, it's typically $250 to $500 per treatment. And we'll usually incentivize the patient and sell them a package of 6 treatments for the price of 5 for $2,500.
And with me, what I'll do is I will first, if it's full face, then I'm charging them $1,000. If it's a neck, I'm typically charging about $750, and if it's a chest, I'm charging another $750. And we try to get them to commit to doing at least 3, and I don't incentivize necessarily and take the last treatment off. It depends if I'm having some type of a special or a flash sale or something like that. But patients feel like the prices are fair. If it's stretch marks, really stretch marks can be expensive or not. It depends on the area. If it's a scar above the lip or perioral iridities, perhaps I'm charging just like $650 or something like that. So it really depends on the area, the surface, and how much time my technician is going to be in the room. Because as I said, for the Lipocel, the Intracel is something that your medical assistants can do also. As you're just going to obviously delineate what they're doing and how they're doing it. And for hyperhidrosis, I charge $1,500, and I have them do at least 2 treatment sessions for the hyperhidrosis at the higher levels with that.
Next question is, I think you can both take a swing at this. I'm currently using a skin pen, but I've considered possibly bringing on radio frequency. Have you noticed a trend going towards radio frequency when marketing your practice? It's kind of a.
Well, again, it's really apples and oranges. Micro needling alone isn't in the same league as needle radio frequency. In our practice now, micro needling alone is an esthetician service provided, whereas needle radio frequency is a medical service provided. So they're really not even comparable as far as the results they achieve or what you're treating in my practice.
And I agree with that. They're not comparable. The radio frequency microneedling is far superior in terms of what results they can get. And I have seen, in answer to the part of the question, a move towards a lot of radio frequency devices, because a lot of the radio frequency devices can treat, all skin types. And so that's very helpful as well. So you don't have to reach for different machines for different skin types. So.
That's next question. How much pain is associated with the Intracel procedure?
I'll talk first. My patients feel like, I typically numb them for a half an hour to 45 minutes, something like that. But it's so interesting. But my patients don't really complain about a deep level of pain with the Intracel. Maybe some of them that have really tender, traumatic scars, that type of thing. But I totally feel like they just don't complain. And going back to the Intracel versus the radio frequency, the handheld versus radio frequency microneedling, one is only the force of mechanical versus the thermal damage. So one affects the epidermis, the Intracel, and it avoids it affects the epidermis, and the Intracel avoids the epidermis. So that's, kind of part of it as well. So, Greg, I know you were about to say something.
Yeah, go ahead.
Pain has never been an issue with Intracel. We utilize topical numbing creams prior to, so pain really isn't an issue with this treatment.
Mm-hmm.
Okay. If your patient's using retinols, how long do you want them off before radio frequency treatments? Did you hear that?
Greg? Mm-hmm.
I think you meant isotretinoids. I mean, it's so again, we typically won't do anything that penetrates the epidermis if someone has been on Accutane. We like them off of it for 6 months.
Okay. With me, if they're on Accutane, I'll have them off of it for a month, and I'll treat with a radio frequency device, like the Intracel after. If it's a topical retinoid that you're talking about, I don't really have them interrupt their use of topical retinoids at all, unless it's the middle of the winter and the retinoids are really irritating them. And then I'll ask them to not use the retinoids for a week before the Intracel procedure, or for that matter, the Intragen procedure, because I just don't want them to be, over irritated and have a negative experience.
Okay. With the Intracel, do you ever use any off-standard settings?
Every day.
Yes, a lot.
Would you mind abbreviating?
Sorry?
Would you mind expanding a bit? Because the question was
No, so whoever asked that, so for your first 50 to 100 patients with whatever system you're using, you use the recommended treatment settings as set forth by any company that has that system. And then once you have the experience to utilize a system, then you can push the envelope, but you don't push the envelope on the first day that you have it. So I think all of us that have used these systems for a long time have learned how to push the envelope, but you don't do that until you have full confidence in what you're using and what the side effects are with any of these things. So that's certainly in an advanced come to my office for a couple of days and we'll teach you that if you want to learn that.
Yeah.
Right. And for me, I'll push the envelope, especially on the perioral rhytids. A lot of my patients are, upset. They want them gone. They have this coming up. They have that coming up. But that's, only after I make sure that they can tolerate the, company recommended, levels, that type of thing. So, but yeah, we're changing things around and pushing the envelope. But I agree with exactly what Greg just said. You want to make sure that you're actually following the directions of the recommended package from the company before you start going out on a limb and doing things that perhaps you want to get a little more experience before you do.
We've got 2 more questions and then we will wrap it up. Can you use Intracel with PRP for hair growth?
Okay, so yeah, you can. I was never a big PRP person. I looked at it a lot because I see some hair loss in my practice and it's so devastating to people. And I decided that I was going to go with the Keralase system instead, which is using Kerafactor with another machine. But you can use the Intracel with the PRP, and it is helpful to some people. The fact of the matter is the scalp is a really tender area. And some of my patients, I mean, I've had patients that have come in that have used the technology that way, and they're just uncomfortable with the level of pokes in their scalp. I mean, people are just devastated that they're losing hair. So that would not be my favorite, to be honest with you, but you could do it as long as you properly numb the scalp first, which means slathering in a bunch of, numbing paste into whatever areas of the scalp you need to treat. And then making sure when you have the Intracel in there that you're obviously not pulling hair, but that you're only, carefully rolling it over the area before you put in the PRP, which is going to have to be injected. So it's the Intracel and then it's the injections, and it's a lot. So not my favorite way to use it at all. But like I said, I'm not a big fan of PRP at all.
Last question. Is there a max number of treatments a patient could use with Lipocel or Intracel?
I mean, with Intracel, you want to get to their desired goals. And then as their faces change, as we age, our facial fat pads shift and change and we lose. And so we're losing weight from our face when we want to be losing weight from our stomach, that type of thing. So as your fat pads shift, perhaps the acne scarring that we had corrected with the Intracel years ago looks like it's starting to come back, or perhaps they're getting new acne cysts and new acne scarring. So intermittently, some people are going to come in for maintenance throughout the course of, their lives. With the Lipocel, weight gain is chronic and unremitting, and, it's annoying. So I feel like people can come in and use the technology, get to where they want to go, and then try to maintain by exercising a healthy diet on their own. And then if that's not working, they can come back in again. So I would say there's no maximum. What would you say?
I mean, I'd agree with that. I mean, it takes a certain number of treatments and every patient is different to get them to the threshold, which is good as we can get them. But then most patients have a keen interest in maintaining it. So So
Right.
since we've had these systems, again, patients come to really like the results that they're seeing, and they know that it doesn't stop them from aging, it doesn't stop them from getting other acne. So they're very open to maintenance packages as well.
All right, well, guys, thank you so much for, we really do appreciate the two of you coming on. And I know I've had one-on-one conversations with both of you. Dr. Chernoff, you're just the expertise with this one piece of technology. I think I was talking to one of your peers recently. I've never met, that question about settings was really good, because you don't have, a number of your peers are kind of afraid sometimes to say, okay, how far can I take this? And a lot of the companies on the training side will do that 2-day training, then they'll try to take you to a sales conference, where sometimes it becomes a sales conference and not continued education. So to know that you're this comfortable with this piece of technology is outstanding. And I wanted to thank you. And then obviously, Dr. Downey, you are an absolute pleasure. And it's been an absolute joy having you. And I hope that everybody took a lot from this. And if anybody has any other questions, we'll be sending out a follow-up email. But thank you again for attending. I know it's late. And have a great evening. Have a great weekend.
Mm-hmm.
Thank you.
Thank you so much. And I think that people on this call should think about both the Lipocel and the Intracel as a means to achieve ROI that they may not receive otherwise. And these are technologies that don't have tons of horrible consumables, which I think neither one of us said through this whole thing. And that's another thing to consider with ROI. And then dealing with the company, which I'm biased because I do consulting for the company, but they're easy to deal with. There's not a lot of hassle, and the service contracts are not onerous. So those are things that the private practice wants to think about in terms of their bottom line as we try to move ourselves back into opening and into practice and into, quite frankly, making money, which is, we're here to care for patients and treat patients and care for patients, but we also want to be concerned about our bottom lines. And so I think that with these two technologies, people can really enhance their bottom line. So I think that should definitely be one of the take-home messages.
Thank you again.
Pleasure. Have a good night, everybody. Thank you.
Good night.